Hello, I'm Dr. Lawrence Blond. I'm an endocrinologist at the Ochsner Medical Center in New Orleans, Louisiana, and I'm pleased on behalf of my co-authors to present the EASD poster 877, Switching to iGlarLixi versus continuation of glucagon-like peptide 1 receptor agonist, or GLP-1RA, in inadequately controlled type 2 diabetes mellitus, the randomized LixiLan-G trial. iGlarLixi is a titratable, fixed ratio combination of insulin glargine plus lixisenatide that's been shown to be efficacious and well tolerated in patients with type 2 diabetes uncontrolled by oral agents in the LixiLan-O trial or by basal insulin in the LixiLan-L trial. But prior to the LixiLan-G trial, the efficacy and safety of treatment intensification to iGlarLixi in patients receiving either daily or long-acting GLP-1 RAs had not been studied. So in this trial, type 2 diabetes patients who had had diabetes for 1 year or more and an A1C between 7 and 9% while taking once or twice daily GLP-1 RA or once weekly GLP-1 RA plus metformin plus or minus pioglitazone plus or minus an SGLT2 inhibitor were randomized for a 26-week randomized treatment period to either continue on their previous GLP-1 RA or to switch to iGlarLixi. At the end of 26 weeks, those patients taking iGlarLixi who had no rescue therapy or with rescue therapy had an A1C that was 8% or less and had no premature discontinuation from iGlarLixi treatment were eligible to enter an iGlarLixi extension. So of the 255 patients treated with iGlarLixi in the first 26-week period, 230 completed that 26-week treatment period, and of those, 206 entered the extension, and 197 patients completed the entire study. When one looks at the demographics and baseline characteristics, one can see that whether one looks at the GLP-1 RA or iGlarLixi arm in the 26-week randomized population at screening, or the iGlarLixi arm in the randomized population who entered the single-arm extension, these baseline characteristics were quite similar. The primary efficacy endpoint was the A1C change from baseline to week 26. And one can see here that for the patients remaining on GLP-1 RA, there was a reduction in A1C of 0.4 percentage points to a 26-week value of 7.4% A1C. In contrast, the patients who switched to iGlarLixi had a reduction from baseline of 1 percentage point in A1C to a 26-week value of 6.7% A1C. And the reduction with iGlarLixi was maintained at week 52 for the patients who entered the extension. Now we're looking at the proportions of patients achieving an A1C of less than 7 percentage points without documented symptomatic hypoglycemia. This was achieved by 25% of the patients who remained on GLP-1 RA, but by 57% of the patients who switched to iGlarLixi. And if one looks at the individuals in the iGlarLixi extension, the percent achieving this composite endpoint of 57 percentage points was that this was sustained at week 52 in patients on the iGlarLixi extension. 25.7% of the GLP-1RA patients at the end of 26 weeks achieved an A1C of less than 7%, compared to 61.9% of those switching to iGlarLixi. And there was also a greater reduction in FPG and 2-hour PPG in the individuals who switched to iGlarLixi. And among the patients treated with iGlarLixi who entered the extension, the proportions of patients who achieved an A1C less than 7% were similar at 26 and 52 weeks, as were the FPG and PPG levels. Mean body weight increased from baseline by 2.78 kilograms with iGlarLixi over the 52-week treatment period. Not unusual when one initiates therapy that contains insulin. The occurrence of any treatment-emergent adverse event occurred in 47.3% of those remaining on GLP-1RA and 63.9% of those switching to iGlarLixi. Any serious treatment-emergent adverse event was very similar, 3.5 and 3.9% in the two arms in the 26-week randomized population. The most frequently reported adverse events were gastrointestinal adverse events. When one looks at documented less than 3 millimoles per liter symptomatic hypoglycemia, this occurred in 0.4% and 9.4% of GLP-1RA and iGlarLixi treated individuals, and over the 52 weeks in 18% of randomized population who entered the single-arm extension. The events per patient year were less than 0.01% in the GLP-1RA patients and 0.25 events per patient year in the iGlarLixi arm at week 26 and 0.24 events per patient year in the randomized population who entered the single-arm extension. There was one case of severe symptomatic hypoglycemia reported during the first 26-week period in the iGlarLixi group, and safety profiles for iGlarLixi over 52 weeks were comparable with those seen over 26 weeks. In conclusion, switching to iGlarLixi further improved glucose control in patients with type 2 diabetes receiving the maximum tolerated GLP-1RA dose along with oral agents, offering an efficacious and safe treatment intensification option. The efficacy and safety of iGlarLixi were maintained up to week 52 in the extension phase of this study. I also wanted to call your attention to the fact that on the day that this was presented at EASD, the 26-week study, LixiLan-G study, was published online in Diabetes Care. Thank you very much for your attention.